So our next talk is from Mrs. Dilling, and it's leadership training for radiation oncology residents experience in a year-long volunteer workforce.
Hi everyone, I'm one of those 4-minute talks. I have 10 slides. I'm going to move fast. All right, I have no disclosures. Just a little bit of background. Moffitt is affiliated with the University of South Florida Medical School. It has what's called the SELECT program. It is a separate 4-year longitudinal course, and students entering the medical school can apply to the general curriculum or the SELECT curriculum. The students in the SELECT curriculum have this 4-year longitudinal course with a capstone project. The idea is that they get weekly courses and mentorship and development in leadership training. We thought that we could utilize the directors of the SELECT program and 2 faculty who have been very involved in it over at the medical school. Dion Jones is a JD PhD, Joanne Quinn is a PhD MBA. Sarah Hoff helped develop the first-year curriculum for that. And Jessica Frakes, my colleague and now assistant program director, has also been very involved in it. So we had a lot of expertise to draw on right in-house. Prior to initiation of this year-long course, we did an electronic survey of the current residents and prior alumni of our program to look at the importance of emotional intelligence in radiation oncology and overall needs for leadership training. And I think this is going to be presented at ASTRO this year. I believe Ethan, the medical student who worked on this, got a poster or something. I have to check. I couldn't talk with him before I left for this. We came up with about a 9 or 10 lecture course. It runs approximately monthly. It was designed to be a brief overview of a number of different leadership concepts. And we have a number of presenters here. Dr. Harrison in our department, Introduction to Leadership, and the residents took the Myers-Briggs test. There were 2 courses on emotional intelligence, one looking at the self-awareness, self-management domains, and one looking at organizational and relationship management domains. Dorota Heimbeck is a senior leadership advisor and coach at Moffitt. She leads the organization in the organizational development program at Moffitt, and she talked about leadership styles. Dr. Harrison came back to talk about power and influence. Dr. Quinn talked about conflict management. Dr. Fleming, who's the chair of GI Oncology, talked about teams and teaming. Dr. Keenan, our CMO, talked about change management. Jason Lebsack is the Senior Director of Process and Project Management Office, talked about Lean and Lean Six Sigma. And Yvette Tremonti, our CFO, talked about financial decision making and how to make a financial case. Each class had about a 30-minute approximately presentation on the topic by the speaker, and the residents were then divided into 2 groups, and each was given an actual ethical or managerial issue to address that was relevant to the topic at hand. And then the 2 groups had to report back, and then both groups reported their findings. There were a number of different types of issues that they were dealt with. They all represented realistic things that happened either within radiation oncology or were often made relevant to radiation oncology. For instance, for the CFO, they had to make a business case for getting an MRI LINAC, which we had just gotten one, and they had to talk about their lines of thinking based on things that the CFO had been talking about, just as one example. The residents have also been divided into 2 groups for longitudinal year-long projects, and they need to work as a group to come up with solutions to these problems. Dr. Johnstone is our vice chair and clinical director, and he came up with the problems. Project 1 is to improve patient check-in process within our department. Project 2 was to improve radiation oncology treatment completion summaries. Work has been ongoing throughout the course of the year on these formal QI projects, which we can use for the ACGME, obviously. And they're going to actually have a formal presentation to the department faculty in early June. There is a post-course survey that is going out to all the resident participants in the course. There were 10 participants. And that survey has been developed. I believe it's going out to them in the next few weeks. And so we can do pre-post testing. Interestingly, Ethan, the medical student who worked on these surveys in his job out after medical school, worked for a company that designs scientific surveys. So he was able to dip right into his own work, and he's actually a student in the SELECT program at USI. I'm going to say that most of this work was done by the Assistant Program Director, Jessica Frakes, along with Sarah Hoff and Joanne Quinn over at the medical school. I helped kind of facilitate having it happen, but I must say that most of the legwork goes to them. And so if you have positive things to say, it needs to be directed to them. Thank you so much.